So I want to create a requested video on what is taught during the first year, and remember, this is not meant to scare you because I'm going to say a lot of things. Maybe you're going to feel like it's a little bit hard during the first year, but this is the real thing. So I'll be using my course outline. I know at times the course outline changes because I remember when I got here, I even asked for books from other people who did nursing, and you'll realize there's some of the subjects that are usually removed. So this is the course outline that we were given in 2017. So right now I don't know if there anything that has been removed, but this is just to give you something brief on what is here. Hello beautiful people, welcome back to my channel. If you're new here, my name is Loisodor, and on this channel I talk about nursing. I give health tips and also do vlogs. So if that is something you're interested in, then you should consider subscribing. So I'll be reading this from my course outline. Like, I know even in the final exams, like the first year stuff is going to be covered, but for me it's like I already even forgotten some of the subjects who are being taught in 2017. So I'll be reading that out from the course outline, then I'll be giving the slide right here. So to start with, we'll be doing communication. So you'll be doing the critical thinking skills, the communication processes, and I'll also be doing ICT. So remember, for the computer studies, it is also so important because, like, you know, nowadays most of the hospitals, like, we've just removed the paperwork stuff, and like nowadays you just want to like document everything to the computers, and it makes work so easier. So most of the time when you get to first year, people think that maybe ICT is not important, it is just a wastage of time, we are here to just learn anatomy or something. So it's also important in some way, especially with the new technology. The other thing is the biological sciences, and for the biological sciences like microbiology, you'll be doing the concepts like for microorganisms and the classifications, the clinical importance and such kind of things. You'll also be doing parasitology, although I can't remember if we taught that, but you'll be doing the parasitology, the modes of transmission, the life cycles. You'll also be doing immunology, which is about the types of immunity. You'll also be doing anatomy and physiology, and for anatomy and physiology, you'll just be doing the human anatomy and the structure, the function of the cells, the tissues, and so on and so forth. Then you'll also be doing the body systems like respiratory, cardiovascular, gastrointestinal. Yeah. Then you'll also be doing endocrine, musculoskeletal, integumentary, like all the body part system. Then you'll also be doing fundamentals in nursing, and fundamentals is so important because for fundamentals in nursing, this is what brings about the skills, like the skills that you're going to put in practice. So you'll be taught about professionalism, how you're supposed to conduct yourself, what are the elements of professionalism, what are the patient care skills, such kind of things. So you'll be doing the basic nursing procedures. You'll be taught how to do history taking, how to do physical exam, how to do a discharge and admission of a patient. These other small procedures like giving a bed bath, doing bed making, lifting and turning a patient, the positions that you use, types of feeding, and such kind of things. Then also be doing other procedures like vital observations, care of the dead, injection safety, giving and receiving reports, patient hygiene, weighing and recording, like all these processes. Then you'll also be taught the nursing process, about assessment, diagnosis, planning, evaluation, the nursing assessment. Then next, okay, we have trauma and emergency, like first aid. So you find that some of these things, even you want to be taught in first year, some of them will be taken to second or even third year, because for us, like first aid, I don't know, we're taught in the third year or something. So you'll be doing first aid. You'll also be doing the behavioral sciences like psychology. You'll be doing like the background of psychology, personality development, the behavior and social interaction, the learning skills, such kind of thing. You'll also be doing sociology, about the social groups. Then after that, you will be doing the reproductive health and midwifery. So you'll do the introduction to reproductive health, that is the terms that are used, the elements of quality care, reproductive health, such kind of things. Then also do the normal midwifery, and apart from that, you'll also be doing cuts after each and every, like you'll be doing cuts, and then you'll be doing the main exam. So for the normal midwifery, you also do normal pregnancy, that is preconception care, what like the placenta, the physical and psychological changes in pregnancy. Then you also be doing the normal labor, that is the onset of labor, the duration of labor, the physiology and the stages of normal labor. Then you'll also be doing normal puerperium. Now this is after giving birth, so like the physiology changes, the physiological changes, the emotional changes, and the management of normal puerperium. Then you also do the normal baby, like Apgar scoring, the characteristic of a normal newborn. So these are things that you're going to learn and they're going to stick, so you should just not worry yourself. The other thing that you'll be doing is community health, and because you're community health nursing, so community health is so important. Like you need to realize, to understand the concepts of and principles of community health, the policies, the guidelines, the roles of the government in health, like the role and function of the members of the health team and such kind of things. Then you'll also be doing the other services like home visit, the outreaches. So you remember, like if you've watched my other videos, these home visiting and outreach services, we've done them, even like the practical part, we've done them after we had even done with the third year. So the theory part will be taught in your first year. So if you understand this, then even the practical part, it will be so easy for you to understand. Then you'll also be doing environmental health. Remember, our environment is so important. So you'll be doing the types of environment and safety in environment, such kind of things. Then the other thing that you'll be doing is about immunization. So for immunization, you'll be doing the guidelines for administration of an immunization, and you'll also be doing the immunization program, that is the AP manager, the cold chain, the management of the vaccines, what are the vaccines that are given at what age. You'll be doing all that, and immunization is just so big, like it's a really like it's supposed to be covered in even 20 hours, so it's a really big one. Then the other thing that we'll be doing is the biological sciences now too. You'll also be doing pharmacology, so you're going to learn about the drug act, you're going to learn about the calculating the dosages and the common like drugs like the antibiotics, talk about the NSAID, talk about anticonvulsants, talk about like bronchodilators. I know we have so much, like it's too much, but you're going to understand them because you're going to be taught bit by bit, one by one. So another thing you're going to do is nutrition. Like nutrition is so important for our patients, so you're going to know about like classifying the nutrients, the importance of the nutrients, factors that are influencing nutrition, and such kind of things. Then lastly is the medical surgical nursing. So medical surgical nursing is so important, so you'll be doing the medical surgical nursing 1. So what you'll be doing is the introduction to it. Then you'll also be doing the specialized procedures, like there are a lot of procedures that are done to the patients, like biopsies, lumbar culture, talk about the radiological examinations, the radiotherapy, the washers, the stomach care. So you're going to be taught all the specialized procedures as one. Then you're going to be taught some of the medical and surgical conditions, so like respiratory diseases, you're going to be taught in the first year, the cardiovascular conditions, the blood conditions, then even palliative care. So those are being done in the medical surgical nursing. Another thing that you're also going to be taught is gender. I even forgot that you were taught something called gender, and we have exams. So in gender, you're just going to be taught the concept of it, the mainstreaming, the gender-based violence, and some kind of things. Another thing is family planning. So family planning is also important. So you're going to be taught the definition, the methods that are being used. Like I can't even start mentioning, we have a lot of the methods, so you're going to be taught that. Another thing is pediatric nursing. So for pediatric nursing, you're going to be taught the normal growth and development. You're also going to be taught the conditions like pneumonia, asthma, otitis media, anemia, fever, all those kind of things. The urinary tract infection, like we have a lot of conditions, because most of those that are affecting the elder people are also affecting pediatrics, but you need to learn the management of pediatrics in a different way. I'm feeling thirsty already. Another thing is health promotion. I know like there are a lot of subjects, but you're just gonna listen to this. So next we'll be doing health promotion, and for health promotion you'll be doing things like the school visits, the care of the women and men groups, like the community dialogue, how to organize one. It is just about how we promote health in our community. And after you've done all those subjects, you'll be taken for placements, like the first one, nursing care of a patient, and also the MCH and family planning clinic. And when you're done with that, you move to the second year. So I know we have a lot of subjects to do, so this is not to scare you, but just to prepare you so that you can know that we have a couple of them, and you are going to like learn all of them, so you should not tense, but you just have to have an open mind and a clear mind, and everything is just going to be easy for you. And you just gotta have to be serious with each and every one of them, because you find like for us right now, we are really struggling to try and go back and try and read the same things that we were taught in 2017. So it's quite a little bit difficult. So guys, I hope this video was of help to you, and if it did, make sure you like this video, click on the subscribe button if you haven't, and make sure you click on the notification bell so that whenever I post any other video, you don't miss it out. So thank you for watching this video, and see you on my next video.